Hi, my name is Stacy Levy. I am one of the practice owners of Dynamic Therapy Specialists located in Baton Rouge, Louisiana. We are a pediatric outpatient clinic that helps families in the Baton Rouge and surrounding areas. I'm here to talk with you today about how speech therapy in particular can help with articulation disorders. First of all, let's talk about what an articulation disorder is. How do you know if your child has an articulation disorder? I think it's best for us all to understand that our speech becomes more clear as we grow and mature. It is obvious that a 2-year-old will speak differently than a 6-year-old, and our expectations are different. But what's really interesting is that a 2-year-old will develop their speech patterns very predictably up until a later age. And so we can follow those patterns and we know what to expect. It's when those children are delayed in meeting certain milestones with their speech sounds, or they start to use sounds that are unexpected substitutions, or they start to omit sounds that are not expected as well. That's when we would determine that the child has an articulation disorder. Sometimes it's also referred to as a phonology disorder. So articulation disorders can impact a child's ability to express themselves clearly in any kind of context, whether it's academic, social, and even in an emergency context. So it's pretty important. An articulation disorder can also lead to frustration, social isolation, a target of bullying, and even academic difficulties if not addressed quickly and effectively. Academic difficulties could include the emergence of reading and writing. Articulation disorders can most often be thought of as speech sound disorders, phonology disorders. An articulation disorder can be referred to as a speech sound disorder or phonology disorder. It can sound like a child that might say a W for an R or an L sound. They might stick their tongue out for an S. They might also say titty-tat instead of kitty-cat. They might also just leave out sounds in their words. And so that's all very important. But again, a lot of it can be expected at the earlier ages. So it's important for you to contact us in order to decide whether or not your child is doing these things in an age-appropriate or expected way, or if they are demonstrating red flags for an articulation disorder. You might also ask, well, okay, I know what an articulation disorder is, but what caused this disorder? And there are several reasons why your child might have an articulation disorder. It could be due to structural differences. It could be that your child might have a tongue tie or a lip tie, maybe a misaligned jaw, maybe a narrow palate from thumb sucking or finger sucking early on. It could be due to an auditory processing disorder. It also could be due to developmental delays, a hearing impairment, neurological condition, or even due to environmental factors such as a difference in exposure. So our speech-language pathologists can improve articulation by doing a myriad of things. We work on the child's awareness of their tongue and of their lips, where they need to be for certain sounds, the pressure that needs to be applied. We also work on improving the airflow direction, as well as just the breath support that helps with the clarity of speech. So our speech-language pathologists also help articulation disorders by practicing sounds in a predictable hierarchy in a systematic way that's evidence-based. The speech-language pathologists at Dynamic Therapy Specialists know how to achieve the just right challenge. What this means is the child gets just enough support to feel success, but then also feels that challenge where the learning occurs and where the intervention sticks. As soon as you discover that your child has an articulation impairment, it is best to go ahead and initiate therapy with us. It is not recommended for you to wait and see if your child outgrows the articulation disorder, especially if you have already sought out a speech and language pathologist in order to determine if your child has the articulation disorder. If you receive that diagnosis, you need to go ahead and initiate therapy. If you wait and see, you run the risk of your child starting to learn bad speech patterns and bad speech habits, which will only later cause challenges as we try to intervene and correct the sounds at a later age. The other reason why you should not wait and see if your child outgrows an articulation disorder is because of the strong link between the speech sounds that the child makes and early literacy, early reading and writing skills. This further emphasizes the need for intervention for articulation disorders in order to ensure a solid foundation for later academic success. Thank you for listening to my talk on articulation disorders and how dynamic therapy specialists can help your family and your child. If you are concerned about an articulation disorder with your child or any other concern, I would encourage you to reach out to us and our team of specialists so that we may help you in your individual needs.